Pathophysiology of pneumonia. The image illustrates the step-by-step pathophysiology of pneumonia, a condition characterized by inflammation of the lung parenchyma, primarily affecting the alveoli. Explanation: predisposing factors. The process begins with various predisposing factors, which can include infections, bacterial, viral, fungal, aspiration of gastric contents, inhalation of irritants, or compromised immune systems. Inflammatory reaction in alveoli. These factors trigger an inflammatory reaction within the alveoli, the tiny air sacs where gas exchange occurs. Formation of exudate. The inflammation leads to the formation of exudate, a fluid rich in proteins and inflammatory cells, which accumulates within the alveolar spaces. Interfere in diffusion of gases. The presence of exudate and inflammation interferes with the normal diffusion of gases, oxygen and carbon dioxide, across the alveolar capillary membrane, impairing gas exchange. Neutrophils migrate to alveoli. As part of the inflammatory response, neutrophils, a type of white blood cell, migrate to the affected alveoli to fight off the invading pathogens or remove irritants. Occupy air-filled spaces. These migrating neutrophils, along with the exudate, begin to occupy the air-filled spaces within the alveoli, further reducing the functional lung volume available for gas exchange. Mucosal secretions and edema. The inflammatory process also leads to increased mucosal secretions and edema, swelling, in the airways and alveolar walls, narrowing the air passages. Interfere in normal ventilator process. The accumulation of secretions, edema, and cellular debris interferes with the normal ventilatory process, making it harder for air to move in and out of the lungs efficiently. Partial occlusion of bronchi alveoli. This interference can result in partial occlusion of the smaller bronchi and alveoli, leading to areas of reduced or absent ventilation. Decreased alveolar O2 tension. The compromised ventilation and impaired gas diffusion cause a decrease in the partial pressure of oxygen, O2 tension, within the alveoli. Hypoventilation. The overall effect is hypoventilation, meaning inadequate ventilation of the lungs, leading to a reduced amount of oxygen entering the bloodstream and potentially an increase in carbon dioxide. Ventilation-perfusion mismatch. Ultimately, this chain of events culminates in a ventilation-perfusion (VQ) mismatch, where the ratio of air reaching the alveoli ventilation to the blood flowing through the alveolar capillaries perfusion becomes imbalanced. This significantly impairs the body's ability to oxygenate the blood, leading to hypoxemia.